I have to do something about my weight.
That's amazing.
And she gave me some pills.
This is not normal.
You need medical insurance for that. 3 to 5 day recovery. I don't have any pain anymore.
Well, Paula, thank you for joining me today.
Thanks for inviting me.
I appreciate you. Tell me a little bit about yourself and what kind of led, or what was your struggle before with weight loss?
So since probably my teenager years, I usually had overweight. So I was doing diets and low carb, Atkins, keto, exercise, everything, and I will lose weight, but I will not be able to keep it up. So it was hard for me to keep it up. I will lose 30 pounds, gain back 40.
Wow.
So it'll be a struggle, and then made me gain more weight and more weight all the time. So throughout my years, after probably 10, 15 years of doing that, I gained about 100 pounds over my healthy weight.
Wow.
So that's when I decided, I said, I'm already too heavy. And then it was hard for me to go to work, wake up, and I was always tired. So I said I have to make a change. And also my sister, she had the surgery before me at a different place.
Mm-hmm.
And I saw her results, and I was like very excited to have the same results. So that's when I decided to do my surgery here.
That's amazing. Very good. 100 pounds overweight is a significant number. How did you feel? I mean, I know you probably feel this is not normal to feel this way. What is that feeling?
Yes, I didn't feel good. No. It was like I had to always go buy new clothing because the one I had in my closet didn't fit me. So that was like also, and the ones I will find at the store will not look nice. And even though they're big, they don't look nice,
Sure.
So I like to wear nice clothing. I like to be a little fancy, and I was like not finding the things I like. So I said, oh no, I have to do something about my weight.
Yeah.
I went to a doctor first, to my regular doctor,
Mm-hmm.
and she gave me some pills, and those pills were helping me be not hungry anymore. But after 6 months, I stopped the process. I was confident because I had lost about 40, 50 pounds. But then I stopped having those pills, so I started gaining weight again.
Yeah.
And then when I reached because I was weighing back then 230. Now after I reached 275, I said, no, that's too much weight. And the doctor didn't even help me. All the things that she did, all the effort I had to do to lose all that weight, it was like went to the trash. It didn't help me. So the only thing I saw that was radical was the surgery.
Okay. And you had someone, you said your sister, who's had the surgery done before. So
yes, and she is still she hasn't gained any weight after.
Okay.
So
she kind of paved the path for you.
Mm-hmm,
Oh,
yes.
And any other pains, aches, energy level, anything else that was bothering you at the time?
Yes, you're right. I had back pain.
Yeah.
A lot of back pain.
Yeah.
Back pain, and then also my knee. I felt like one of my knees was hurting already, and then yes, I was going through some physical pain for the heavy weight.
Every day.
Mm-hmm.
Sure. Yeah, we hear, a lot of people tell me, they just to get out of bed every morning, they sit there thinking, okay, which way should I turn so this is not going to hurt? And then
when you have the back pain, yes, you're like, I don't even want to go down. I want to sit it down somewhere because if I lay down, it's going to hurt.
Yeah. And how is that now?
That I don't have any pain anymore.
Amazing.
It went away.
Okay. And then, and how did you decide to have your surgery with us, and how did that come about?
First, I had some procedures in the past with you guys. I had the varicose vein procedures.
Okay.
And after I thought about it, because I said, this. I remember I was medical. They had the weight loss surgeries. So I went and checked on which one was the best one for me. I saw the bypass, I saw the gastro sleeve, and I also saw the balloon one.
Mm-hmm.
And I saw that the balloon one will only make you lose certain amount of weight. I need to lose more than that. So I said, It's either the gastric bypass or the gastric sleeve. And when I call, I talked to someone, a specialist, and they guide me through the process. They told me the benefits of one or the other, and because I didn't have insurance, I couldn't do the bypass because you need medical insurance for that. Just for the complications that I may have, they told me. So I went by to get the sleep.
Okay, very good. And what was the process for you before surgery and preparing for surgery? Who else did you talk to? How were you educated?
Yes, there was a lot of education, especially on the diet side. So we had some training with Zoom meetings with the dietitian. She went through all the PDF that she gave us like a guide of probably 40, 50 pages of the things that we had to eat, and it was really true. Then she went through all the PDF, and it was very explanatory. She explained that well. If we had any questions, we'd call her and she'll pick up right away. And it was very helpful. And I like that about that.
That's great. And how did you feel the morning of surgery when you wake up and you know the surgery is today? How did you feel?
I was excited.
Okay.
And they told me I didn't have to eat anything the day before.
Sure.
But it was not that hard. So it was fine. I think I only had liquids until 12. After 12, nothing. And it was not bad.
Okay.
When I came to the surgery, I was excited, and it was not bad. So I don't think that's a bad experience at all.
Okay. And how did it feel right after surgery when you wake up? And
that's when I felt I was dizzy. I was a little dizzy. It was like a little weak because probably because I didn't have any water before or food. But then after that, they gave me the IV liquids, and that kept me hydrated, so it was fine. The only thing I couldn't drink any water. They gave me this little water, and I was like, oh, I can't even drink it. When you start swallowing it, it will be so hard. Like so that's the only thing I remember. Like I couldn't even drink water, but it was not bad because they kept me hydrated with the IV.
Yeah, absolutely. It isn't amazing that just a little sip of water in the beginning makes you full. And I always tell patients that it's, you have to really imagine that instead of a big stomach that you had, which was the size of a big balloon, it's just a straw, thin little straw. So you have to drink so slowly the first week or so, just for the swelling to go away, and then you're able to, hold food down. The first couple of days at home, how many days did you take? Did you have to take pain medications or anything?
Oh yes, I had some pain medication that you guys prescribed for me, and omeprazole for the stomach. And but if you take everything like you're supposed to, you'll be fine.
Okay. A lot of pain or minimal?
It was a little painful. Yes, okay. That's why when you have the pain medication, it's handleable.
Okay. So the overall recovery, at what point did you start walking around after surgery or really kind of being more active eventually?
So I started walking the same day. Same day I went to the restroom by myself. I was able to do everything. And I had the surgery on a Friday, and I had to go to work on Wednesday. So probably 3 to 5 day recovery.
3 to 5 days recovery. Okay. And at some point, would you say were you good to take care of yourself? But
yes,
5 days?
Everything by myself. Yes, I was able to go to the restroom, and yes, it was a little painful, but if you take your medicine, you'll be fine.
Okay. And then once the surgery is over and you're kind of past the recovery and you're eating well, what things changed for you? How did you see yourself differently?
So I like that I could eat anything in small portions, and I will get full really quick. So I didn't have to eat because like when you're before the surgery, you had to eat so much to get full. Now you will not have to eat that much, and you will get satisfied, and you can do the diet. You can do the healthy lifestyle now.
Yeah,
it's handleable, and then you can you can be healthy and not and don't go through all the things that you go through before the surgery.
And when was your surgery?
That was on April of 2022.
2022. So over 2 years ago,
Over
a little
2
bit. Yeah. And how much have you lost?
75 pounds.
Wow, amazing. And how does that feel different on a day-to-day basis?
I like that everyone compliments me. Oh, wow, Carla, is that you? You lost weight, you look so good. And I like that feeling that when they compliment me.
Yeah, that's amazing. And as far as your back pain, knee pain, any of that stuff, how does that
Went
feel
away
now?
completely. Yeah, I don't have any pain anymore. And back pain. Back pain sometimes comes back a little bit, but it's not as strong.
Sure.
Hmm.
Okay. What challenges do you think you had after weight loss surgery on this journey to lose 75 pounds and keep it off?
Well, I had to have a healthy lifestyle now. You have to eat healthy. You have to follow what the dietitian give you to in order to succeed because you have to eat healthy at the beginning. At least for a year, you have to follow the diet.
Sure.
If not, I don't know what the consequences are, but I think that you need to do that in order to lose enough weight and keep it off.
Absolutely. And what other things helped you on your path? I mean, were you in touch with our dietitians, or did you have part of the support group that helped?
Dietitian was always available. I remember they would call me like maybe at the beginning they call me every week, and then they started calling me after like every month, after probably 6 months. And then if you want to continue, you can keep calling them and they can call you too. I just decided that I was fine after 6 months, but they can keep helping you.
Great. Were you part of the support group as well on Facebook?
No.
Not that. Okay. That's okay. And then, so what have you done differently since, compared to before surgery? What are the things that you do now that are making you so successful?
So I do exercise. I exercise, also try to eat small portions 5 times a day, so I don't get hungry every 2 hours. I eat like like what is considered a snack every 2 hours, and if you like try to eat small portions so that it doesn't grow back, because I heard that your stomach can grow back, and then I don't want to like go through the surgery process again just to lose more weight, and that's not healthy either to have the surgery.
Oh, absolutely. No. Okay. And then, what what advice would you give to someone who's considering weight loss surgery or really trying to lose a lot of weight?
I would recommend to do the gastric sleeve because uh, it's it's the best. For me, it was the best decision I made. I believe that if I wouldn't have done that, I would probably be now 300 pounds or even more than that because the way that maybe, I don't know if it's because we're Latinos, we eat so much carbs and fat and all these things that are not healthy. It's hard to be away, get away from those. And then now I can eat them. I just have to do it in small portions.
Yeah, mother.
And then I don't block myself from eating it. So I just have to it has to be in small portion and eat healthy after that.
Yeah. I mean, Latinos are obviously very social, and a lot of things revolve around food, and being mindful of what you're eating is definitely key. What things do you think you wish you knew before you did the surgery? Anything that you didn't know or you actually helped you to know?
Before the surgery, things I wish I knew. Um, Not really. Maybe because maybe the diet part. Maybe I should have been healthier before.
Yeah.
Yeah, and then but um, everything else, like you guys helped me a lot on the things I had to know before the surgery, like what's gonna be the process, like the diet part of the process, I think that you guys were very helpful, and thank you for that.
Well, I mean, you're an incredible success and absolutely a role model to so many who trying to not only just lose the weight, because the long term keeping it off is really the main goal. So what's next? I mean, okay, so you lost 75 pounds. You're doing amazing. What's the next goal?
I want to keep losing weight, so I'm exercising. I try to eat healthy. Sometimes it's hard because I have kids and I eat like all this junk food, and I sometimes like take a bite.
Sure.
But still, I just gonna keep losing weight,
All right. Well,
and I think I can do it with the help of the surgery.
absolutely you can. And I wish you all the success.
Thank
Okay,
you so
thank
much.
you so much.